Okay, let's get started. Can you all hear me fine? Just put in the chat, okay, or something. Okay, amazing. Thank you, Ali. Thank you, Ali. So this is the second workshop in our Publishing Masterclass series. We will be talking about research design and methodology. We will be providing some definitions, some examples, and we'll be going over a particular activity together to really understand some of the differences between different research designs and methodologies. Before we get in, just as a reminder, this is part of the Methodologists, which is my consulting company. We provide research method services worldwide. This is part of our Publishing Masterclass series that we're offering to students and professionals in Pakistan, but we have lots of other series, some of them that are in development and we may offer in the very near future. So this is the second of a four workshop series last week, which all of you were there, maybe except one or two of you. We looked at how to develop a research question from an idea. We looked at literature reviews, different types of reviews. We looked at how to really identify gaps, and we looked at how to develop research questions. And based on your feedback, you found that workshop really helpful. So I appreciate all the feedback that you have given. And some of the feedback for improvements that you have provided, we have tried to implement in this workshop and workshops moving forward. So hopefully this is more useful to you. This workshop is the second one. It's on mastering research design and methodology, but we have two more workshops that are going to be in July. The third workshop is scientific writing and publishing strategy, and the fourth one is enhancing your academic CV for residency and beyond. I think most of you are signed up for all of them. Some of you are signed up for individual ones, but consider signing up for the ones that you haven't signed up for, especially the last two that are going to be in later July. I think they'll be very helpful and very applied. For the purposes of this workshop, there we have three learning outcomes. First is to really look at some definitions and language. We did this in the previous workshop as well, where we talked about having a common language for us to refer to different but very similar ideas and concepts. And once we have that language, then we build on the foundation of understanding how different methods, different methodologies can be used to do research and to publish. We're going to talk about three different, what is referred to as research approaches. And we'll, of course, get into that, but this is also part of the language. And then we'll use this understanding of methodology and methods and research approaches to, in the context of a few articles, to further really enhance our understanding of these research approaches. And to know that when we're in the field, when we're looking at different articles, we can easily identify what we need to identify because we have the language down, we have the concepts down. At the very end of it, what we're going to do, and this was feedback given by a few of you, we're going to look at methodology, methods, and research approaches within the context of three examples together. So one note here is that in the calendar invite, I sent three articles. I have pictures of those articles on the slide, but those three articles are three PDFs. It would be great if you download them and just have them accessible, because it would be great if you follow along as I go through the articles and we can have a conversation about different aspects of the articles. Okay, so let's just talk about definitions. I think the first point to understanding methodology, study design, research approach is to understand the difference between what people mean when they refer to methodology and what people mean when they refer to methods. And if you can tell based on how I'm describing it, methodology and methods are different. There is a nuance to both of them. Often people interchange them, but that is technically inaccurate. Methods are not methodologies, and methodologies are not methods. But what are they? Methodology, you can think of as the umbrella. It is the overall approach. It includes what study design you choose. It includes what sampling methods you choose, and we'll talk about those too. It also includes data collection, data analysis. So think of it as a cross-sectional study, right? That is a methodology because a cross-sectional study has its own package of guidelines. It has this package of guidelines of what to do when it comes to sampling and recruitment. It has its guidelines on what to do for a cross-sectional survey, right? It is a package of guidelines. A randomized controlled trial has a package of guidelines on blinding and randomization and sequencing. That is a methodology, right? Methods are those specific strategies, aspects, right? So we say data collection methods. I used a survey, right? That's a data collection method in and of itself. But a survey is not a methodology, right? Because it doesn't necessarily include how to recruit and sample. They're a bit distinct. Data analysis methods, right? I analyzed and used regression. That's a data analysis method, which can be included under the methodology of a randomized controlled trial, but it is not randomized controlled trial, which is methodology, right? So there's a unique distinction here that I want you to know. So when I refer to methodologies, I'm referring to those big package of guidelines. Quick examples, like I said, cross-sectional designs, longitudinal designs, right? Like observational studies or multiple cross-sectional studies, or retrospective cohort studies, or case-controlled studies. There's also randomized control trials, longitudinal, there's cross-sectional, but there's also qualitative designs, right? Which we'll briefly touch on, like grounded theory, ethnography, things like that. Those are also methodologies. There's mixed methods research, which is not necessarily a methodology per se. We'll talk about this. It is more of an approach to research. So using this understanding, now, I mean, one caveat is I use methodology and study design interchangeably. Methodology is study design and study design is methodology. And I think the way people generally use study design is how they should use methodology. Methodology is a package of guidelines. Different study designs are a package of guidelines for data collection, recruitment, and sampling. Approach is a little bit different, and we'll talk about the three approaches to research in a couple of slides, right? But quickly, there's quantitative, there's qualitative, there's mixed methods. Within those approaches, there are different study designs. There's mixed method study designs, there's quantitative study designs like generally randomized controlled trials, and there's qualitative study designs like grounded theory and participatory action research and case study and things like that, right? So there's approaches, think of approaches as above the methodologies, there's methodologies or study designs, and then under that are the different data collection, sampling, recruitment, analysis methods, right? As components of studies, this will make more sense if you understand those key concepts, right? So the first is, of course, the approach and the methodology or study design. And this talks about, what approach did you choose? Quantitative, qualitative, mixed methods, why you chose that approach, and what study design or methodology you chose, right? So if you say this is a cross-sectional study, why is it a cross-sectional study? Why did you choose that? What are the reasons? What are the benefits, what are the pros, and what are the limitations? But there's also other components of studies, right? Sampling and recruitment. So this really defines the sample of your study. It defines how you identified that sample. And also identifies what strategies you use to recruit participants, right? And those could include many different strategies. Data collection, this includes data gathering activities, right? Like surveys and interviews and observations and documents, right? These are all data collection methods. Well, I'm just briefly reviewing it because we're going to talk about some of these in a bit more detail in turn. Data analysis quickly is how you analyze and interpret the data from the data collection methods, right? So how do you analyze the survey data, right? What proportions do you want to find? How do you use specific statistical methods? Why, right? How do you analyze interviews with participants and so forth? And the last component here, and very, very often missed in most research studies, is knowledge mobilization. In the end, research, the goal of research is to generate knowledge. And part of generating knowledge is to share that knowledge and share that knowledge in meaningful ways to different audiences, right? And that is what knowledge mobilization is. You are mobilizing knowledge. Of course, knowledge mobilization is in of itself a field and requires a separate entire workshop dedicated to it, or workshop series. But essentially think of it as ways of conveying your findings. The most obvious example is publishing in a journal, right? If you publish in a journal, you do convey your findings, you write it up, and then other people can read it and other people can understand it. And maybe they can email you to ask you about questions. However, knowledge mobilization is a bit broader than that. That's what you call traditional knowledge mobilization, like publishing and presenting at conferences. Why it's traditional is because the audiences here are academic audiences. And the people who are going to read your paper are likely experts or familiar somewhat to some degree in your topic, or they're students interested in getting into the field, right? But they're not the only audiences that might be interested in your work. Maybe they are, but they generally won't be. So that's why there's non-traditional, more innovative methods of knowledge mobilization. And those get into things like opinion pieces, news articles, videos, right? Recently I did a project where we had an art gallery of people's experiences where essentially they basically painted something and we just posted it in the lobby of a government building. But these are ways to convey findings that you generate from a research study. I know the example is very intense, innovative, but I wanted to give you a spectrum of traditional and non-traditional, and there's lots of things in between. But let's get into some of these in a bit more detail, right? So approach and study design, I've already alluded to this to some degree. There are three approaches: quantitative, qualitative, and mixed methods, right? And I want you to remember that this is one of the most important things in your research journey. There's quantitative studies, there's qualitative studies, there's mixed method studies. Quantitative studies, randomized controlled trials, right? They use the use of biological tests, right? Measuring, respiratory rate, for example, measuring the effectiveness of a treatment or the efficacy of a treatment or a drug, right? These are quantitative studies. They use p-values, they use confidence intervals, they use statistical methods, regression. These are quantitative studies. Qualitative studies, and I can understand probably most of you are very familiar with quantitative studies, so I don't have to repeat that multiple times, but I repeat it because qualitative mixed methods are likely new to you. Qualitative studies are very different. They use interviews, generally speaking, or a variation. They talk to people on their experiences, their perspectives, their preferences. They understand what people want, what people need, to understand what works and why it works. Let's think of it this way. Quantitative is whether something works or not, right? I will look at, for the best example that you're probably familiar with is look at a drug, give that drug to an experimental group and give a placebo to a control group. If there is a difference, statistically, the drug works, right? Very simple. The conclusion from that is the drug works. Very easy. But you can't really make the conclusion of why it works. You can theorize, right? Physiology and all, you can theorize, generally speaking, right? But the randomized controlled trial itself cannot necessarily give you ideas of why it works. And I mean, even more philosophically, randomized controlled trials are so limited in their context, they can also not tell you why that drug that works in this context, in a very specific population, may or may not work in the real world. And there's numerous examples out there where a randomized controlled trial shows that it is effective, but when the drug is funded and provided to patients, patients don't see the same outcomes in the real world, right? So it tells you whether it's effective or not, but it doesn't truly tell you why it is effective or not. And that's where qualitative comes in, right? Qualitative is the second, and I would say a very complementary approach to developing a holistic understanding of a topic. And it uses interviews, it uses focus groups, it uses observations. I mean, depends on the study design to really understand people's experiences, preferences, and interviews and preferences. So in the example of a drug, right? When the drug is given in the real world and it's not working for a particular patient, you might ask them, how are you using it? Are you even using it? Are you adhering to it? Right? What are the barriers to using it? What are the barriers to accessing it? Questions like that, right? And in those questions, asking people, you oftentimes they'll provide like all kinds of different, sometimes stories, sometimes experiences, very broad and vague aspects of their life. You may get, instances of they are not using the drugs appropriately. They're not administering appropriately, or they're missing, right? They're missing stuff, right? All this stuff you'll uncover with qualitative research, and it'll give you a holistic understanding of the factors that might influence the impact of that drug on the patient's lives. And you do that by having a conversation, which we call interviews in this case. I hope that makes a little bit of sense, but of course, we're going to reiterate and reinforce that difference between quantitative and qualitative. Mixed methods is a combination of those two aspects within one study, right? So you have the quantitative aspect, a drug works, things like that. But then you also, within the same study, within the same population, you want to know why it works and why and how people might use it. And again, we'll talk about these in a bit more detail. So, I mean, these are just quick examples. We're going to take a look at these examples together at the very end. But you have these examples in the calendar invite as well. So this is a randomized controlled trial, and we'll take a look at how I know it. But this is just reiterating sort of how randomized controlled trials work and some of the differences in how they're framed. So you can tell, in the title it says randomized controlled trial. It's looking at the ovarian cancer population. It's looking at screening and mortality after follow-up, right? And so it's really measuring those outcomes, screening rates, I assume. We'll look at the abstract in a little bit, but it's looking at mortality after follow-up, right? What's the mortality after follow-up? That's really the question here, and that's what quantitative research is really good at answering. Qualitative research is a little bit different, right? This, if you just read the title, it's about exploring the outcomes that matter most to young people treated for chronic pain, qualitative study. So this is asking about, there's various different outcomes for chronic, that come from treating chronic pain. There's, reduction in side effects, improved quality of life, improved in daily activities, lots of different outcomes that can come. But wouldn't you see a value in understanding what young people in this case value the most, right? If they value quality of life the most, if they value actually being able to get up from their bed and walk around the most, as a physician, as a provider, as an administrator, you would want to know that, and then you would want to implement that in your treatment plans, right? That's what a qualitative study really gets at, as one aspect of it. And then a mixed methods is putting those two together in the same study. So this is looking at vaccine confidence and vaccine hesitancy at the start of the COVID-19 vaccine deployment in the UK, and this is a mixed method study. So they did a survey to understand how people were confident, how how confident people felt in the COVID-19 vaccines. And then they did interviews to understand the group of people that had expressed low confidence in the survey to understand why they are expressing low confidence and why are they hesitant to take the COVID-19 vaccine. Things like, and you have heard this as healthcare professionals and physicians, things like it's not natural, it was developed rapidly, right? It was too quick, right? They didn't do enough testing. All these kinds of things were reasons that came about from the qualitative aspect of this mixed method study, um, and helped to help to build a more comprehensive and holistic understanding of vaccine confidence and hesitancy within one article. And that's what a mixed method study does. But you might be asking, before I end this off here, but you might be asking, why do we not just do all mixed method studies, right? Why isn't every single mixed method study? Because quantitative and qualitative are complementary and they both together, especially on the same sample, build a more comprehensive understanding of the issue. I mean, there's many reasons for this, right? One very important reason is quantitative researchers generally don't have the experience of qualitative research. So generally they do quantitative research and get it published without the qualitative aspect. And this is a case all around the world. Another aspect is qualitative research increasingly in the West, and I'm located in Canada, don't have the experience of quantitative research. And so they just publish qualitative studies. A more pragmatic way is that qualitative research, just think about it, you talk to people, you talk to maybe 30 people, let's say. We'll talk about sampling in a bit. And you get hundreds and hundreds of pages of data. That's a lot of data to put in one article, right? It becomes even more difficult to put all that data in one article when half of that article is the quantitative arm. And with journal restrictions, like sometimes 3,000 words, sometimes it's 5,000 words, you have to write an introduction and discussion. Your findings is like 800 words, 400 words are 400 words of the qualitative aspect, which represent 30 interviews. Like that becomes a very difficult thing to do, really drilling it down of hundreds of pages of text of data into 400 words. That's pragmatically very hard, but it's also, and this is a point that I've made in multiple circles, even in advanced circle, it's also ethically questionable, right? And why I say that is think of it this way: if that's the only article you're going to publish on that topic, and you did all that effort, did all that research to talk to people and to do a survey, and out of all that data, all the nuance and experiences, you're going to only say in 400 words, you're going to miss most of what was mentioned. And ethically, that is wrong. Ethically, as a researcher, you need to represent your findings in the most accurate and comprehensive way as possible. But it becomes very difficult for mixed method studies when you try to push all those together in one 5,000 word manuscript. So these are all reasons why mixed method studies are not more prevalent, but they are there and there is value to it. So yeah, spent a lot of time on that, but I think that is essential for understanding. Let me just stop here for a couple of minutes and ask if anybody has any questions about the three approaches. You can either open up your audio or say it in the chat. Okay. I'm not seeing any questions, so I'm gonna move forward. Okay, so we talked about approaches, right? Let's talk about sampling and recruitment. So in the remaining slides, how we talk about sampling and recruitment and data collection, all the other components, we're going to talk about it from the perspective of the two main approaches, right? And mixed methods is included in that, but mixed method includes the two approaches. We're going to talk about quantitative and qualitative ways to sample and recruit individuals. Excuse me, sorry. So sampling and recruitment. Depending upon whether the study is quantitative, qualitative, or mixed methods, you need to adopt different sampling approaches. And why you need to adopt different sampling and data collection approaches is because those designs are asking and answering different types of questions. You know, whether a drug is effective or not, and why it's effective. Very different questions, and the same approaches of sampling are not necessarily the best approaches. You're most familiar with probability sampling, which is statistical sampling, and this happens in quantitative and mixed method studies. This essentially, and I probably don't need to repeat it, but the essential idea behind probability sampling is determining the adequate size of a sample in your study based on the characteristics of the broader population from where the sample comes from, and doing a power calculation based on those characteristics. And this can be done very easily in most statistical softwares. So you are essentially measuring how representative that sample is to the broader population, right? So for example, my sample of 100 patients with diabetes, and how are they similar to the broader population of diabetes, right? In terms of their characteristics. Or how different is their age to the broader population of diabetes? How different is their severity of diabetes to the broader population of diabetes? The more different your sample is, the less power your study will have, and the less representative your study is to the broader population. Right? That's the assumption behind it. It's very easy to do statistical calculations to really determine that. But you're really measuring how heterogeneous your sample is to the broader population. That's quantitative probability sampling that you're most familiar with. But there's another type of sampling that's used in qualitative and the qualitative portions of mixed method studies, and that's called purposive sampling. Purposive sampling is not about representativeness to the broader population, but it's about choosing people for your qualitative study that will help you answer the research question. So if your research question is knowing, why are people with diabetes using this particular drug or intervention? Or why aren't they adhering to insulin and the new type of insulin shots? You will do interviews, and you will recruit people with diabetes who are not adhering to the treatment. You will include those people who will help you answer your question. And therefore, you are using purposive sampling because you're purposeful in your sampling approach, right? And we can have lots of conversations about different types of purposive sampling. So I mean, very quickly, you can get people, if you think of a bell curve, right? And you think of the same example of people with diabetes, people with diabetes on the bell curve, some will have severe diabetes, they'll be on this side, I guess this side for you. Some will have less severe diabetes, but a lot of people will be in the middle, right? Purposive sampling and different purposive sampling approaches really try to understand which part of this bell curve are you interested in. Are you interested in people with most severe forms of diabetes and why they're not adhering? Are you most interested in people with less severe forms of diabetes and how they're using these treatments? There's different types of approaches and the different like fancy words for those. But you understand that it's purposeful. You need people to answer your questions, But the goal is not to generalize, to statistically generalize to the population. There's some aims of it. You want it to be somewhat similar, but the idea is to understand experiences, and experiences in of itself can be very broad, but even interviewing one person can help you understand the experiences of many people. It may not give you a comprehensive understanding, but it'll still help you to understand, right? Data collection methods. So, of course, I've alluded to this in previous slides, but quantitative and qualitative use different data collection methods. Biological tests tend to be, if not always, in quantitative and mixed method studies, right? EMR data or databases also tends to be in quantitative and mixed method studies, right? A retrospective analysis of mortality outcomes for people who came into the hospital for screening. They came into the hospital, their data was recorded in the electronic medical record, and then years later, you went back and you looked at all the patients that came in for that particular screening, and you looked at their 5-year survival, right? That's the EMR is a data source, and the data you extract from the EMR is a data collection method. And what's usually the EMR you refer to as an in-house database. Because everything's being recorded, and when you start to use it for a study, it becomes a data source, and the data you collect, the process you collect the data becomes a data collection method. That's what you're most familiar with, right? But qualitative has different types of data collection methods. It doesn't use biological tests or EMR data or databases. It generally uses interviews. That's probably the most common data collection method for qualitative researchers. And when I say interviews, I don't mean diagnostic interviews. Diagnostic interviews are a clinical tool, right? They're not a research tool, though in some cases they have been used as a research tool. And there are overlaps between what a qualitative interview and diagnostic interview is, especially when both are used for research purposes. Qualitative interviews come from a different tradition. They don't come from medicine. They come from nursing, actually, and they come from social sciences. Diagnostic interviews come from medicine. Qualitative interviews have its own set of guidelines of semi-structured, unstructured interviews, where essentially you have an interview guide, right? And the interview guides start off with really broad questions, right? So for example, for the example of diabetes, people with severe diabetes, you might ask the question, how do you use this drug in your daily life? Just think about that question. Very broad. Two people can answer that question in extremely different ways. But that's why qualitative interviews is so interesting. And that's why qualitative research use interviews, because you want those different responses. Those different responses help you to build a better picture of what's happening, help you to build a better picture of the experience of diabetes patients and any other patients. But there's other types of data collection methods. Focus groups is another one of them. And focus groups you want to think of as group interviews. Interviews are done usually one-on-one. Focus groups are done usually one with 5, 6, 7, 8 people around a circle talking about a particular topic with an interview guide, a focus group guide, and really going around to share their experiences. Right. And there's pros and cons to both, which is a topic of another investigation, a topic of another workshop, but the purpose is very similar. You want to know people's experiences to help you build a more holistic understanding of the particular topic. And finally, surveys are interesting because surveys can actually be both quantitative and qualitative at the same time. Just think about it. When you've done a survey, maybe it doesn't apply to you, but it might apply to you for some of you. But when you've done a survey, there's usually a demographic section, right? What's your age? Things like that. What conditions do you have? What's your date of birth? You might have the main survey questions, right? So if you're doing if you're assessing depression in a particular unit, you'll have like a one of the scales that's been validated for measuring depression. And in some cases, there may be open-ended questions that people respond either in an interview style just for that question, right? Because sometimes, and you've done all this, especially in a diagnostic interview, you say the question, they answer. But in some cases, they're doing it themselves. So in some cases, you'll have an open-ended question like, how do you intend to use this? Or do you have any other thoughts or experiences? Or how do you manage your diabetes? And then a text box where people can just type in or text or anything into that text box. That aspect of a survey is qualitative, is because it is an open-ended question. It is a semi-structured question, a broad question, like in the interview guide example I gave, but the answer is very different. There's no multiple choice, right? Multiple choice is very structured because the participant can only respond in the multiple choice way, right? They only have a selection of responses. But for an open text box, they can respond in all kinds of ways, and they can even not respond or respond very with one word or respond with 500 words, right? That's what qualitative does. You want that detail and data, even if a lot of it's noise, you want that detail and data to help you build a more comprehensive understanding of people's experiences and why they do things they do. Okay, I'm gonna take another 2-minute break here and ask if anyone has any questions about sampling, recruitment, and data collection. You can put it in the chat or you can just say it in your audio. Okay, I see. Okay, we got a question from Alina. Yeah, it's a good question. It's a good question because I can understand that I think most of you are healthcare providers, physicians or nurses, or most of you might be physicians. It can be difficult to understand the difference because you're most familiar with using a survey in the form of an interview. Let me try to explain it again, right? One difference between a survey that you're familiar with, a survey, for example, what's a very common survey? I use the general, what is it? The general life survey or something like that, GSS, or right? Just think of those validated surveys. Those are validated surveys, and you might implement them to understand general life satisfaction, understand depression, or understand suicide risk, and they're often done routine in medical practice. Sometimes they're done for research purposes. And what I mean by that is when you're doing it for medical practice or medicine or clinical practice, You're doing it to understand suicide risk and understand whether that can influence your treatment in that moment for that patient. When you're doing it for research, you're doing it for a bunch of people to analyze it and to make conclusions about that group of people and publish it, right? That's research purposes, that's clinical practice purposes. And both of them can happen at the same time too, but the purpose is slightly different depending upon how you want to use it. But that's what a survey is, right? An interview, there's two ways to understand this. There can be a survey interview, right? Which many of you probably have done. You take the survey that I mentioned, right? And then you go to a patient and you go, okay, rate the following, rate your overall life satisfaction. 1, not satisfied at all. 2, somewhat satisfied. 3, satisfied. 4, very satisfied. And then you repeat that, they answer, you repeat the next question, they answer, you go back and forth. That's a survey interview. You can also just do a survey, not a survey interview, where a patient is sitting in the emergency department and you give them the survey, like, can you answer these questions and just return it to me? That's not a survey interview anymore because you're not asking them the questions. That's all what you're familiar with. And I say that because I want to reiterate what you're familiar with. Qualitative interviews is a bit more immersed. Qualitative interviews doesn't use a validated survey. It uses broad, open-ended questions. And it's generally 10 questions, what I've seen in an interview guide. And it's a conversation. It's an open-ended conversation. So think of what's the best example I can give you? Think of like having a meeting with a mentor or a professor that you want to work with, right? You're not going to go to them with a validated set of multiple choice questions, right? You're going to go to them with a set of questions. You want to know their experiences. You want to know why they publish this. Why are they doing work in this? You want to know how they can get involved. These are all questions that are part of a conversation, not a survey. That's what an interview is. It's a conversation. It's a discussion. But the purpose is analogous, but not the same. The purpose of an interview with patients is to understand their experiences. So you come with a set of open-ended questions to really dig deep into what they're doing, why they're doing, and what they want from their care. One example I'm doing recently is there are differences, obviously, between patients and physicians and nurses and pharmacists. There has been no attempt to really bring in all the literature together to understand those differences. But there's studies I've seen where they interview patients, interview physicians, interview nurses about, for example, cancer screening, right? And they ask very, very similar questions, right? They ask physicians, how do you engage in the screening process? Can you walk me through it from step 1 to end? They ask nurses, how do you comfort patients who are undergoing screening? And then they ask patients, what is your experience like when you're undergoing screening? All of those are very broad questions. And that's just one example of a question. But when you talk to them, you have multiple questions all around the same topic to answer your research questions. That's what an interview does. It's a conversation with the people to better understand their experience, unlike what a survey or a survey interview does, which is generally the foundation is a validated survey, or it doesn't even have to be validated, a structured survey, a structured set of questions that are closed-ended that can be answered either a yes or no, or as a list of options. And you don't really give participants the opportunity to say anything else. Does that make sense? Thank you for that question, Aline. Amazing. Glad you understand. Okay, let's move forward. There's 2 more topics I want to talk about before we get into actually looking at some studies. And when we look at the studies, it'll bring all of this together, hopefully. And its data analysis is the second last one. So quantitative and qualitative data, I've said before, analyzes data differently. They are different research approaches, they have different methodologies, they have different data collection methods, sampling, and they also have different data analysis methods. Right? Quantitative usually uses some form of descriptive statistics, correlation, regression, and advanced statistics and modeling. Right? You've read lots of quantitative studies, lots of randomized controlled trials, and they generally use a variation of statistical methods to answer the question of whether something is working or what is happening to patients in terms of mortality or prevalence or things like that. And different tests, and there's lots of different tests, and different tests can be used depending upon the type of outcome that you have, right? And the type of variables you have, right? Categorical variables versus non-categorical variables, that changes the type of test you do. And I was thinking of doing two set of workshop just on statistics, just to give you a crash course level of introductory statistics, not necessarily how to do them in a software, but understanding the language. And I'm exploring that, so just stay tuned. Maybe we can have those workshops later this summer, but talk about outcomes and variables and things like that. But that's quantitative statistics. Qualitative is, the example I have here is thematic analysis, right? Because that's usually what people associate with qualitative analysis. But it's not the only one, and I'll talk about that in a bit. But thematic analysis is essentially the process of identifying themes, ideas, and concepts within words. Let's step back for a moment. Let me explain to you why all of you are qualitative researchers and all of you have skills in qualitative research. All of you have done thematic analysis. I can 100% say you have done thematic analysis. Because every part of writing a paper, doing a literature review, even if it's not published, even writing a quantitative paper, you've done thematic analysis to some degree. Because thematic analysis is taking some data and identifying what are the main points and what are the themes and what are the headings of my paper. So if you wrote a paper before, even if it's for a class, and you wrote a findings section, you're like, this is theme 1, I'm going to talk about this. This is concept 2, this is section 3. That is thematic analysis. You just didn't know it was thematic analysis, and you just didn't know the language of thematic analysis. Thematic analysis has 50-ish years of methodological text talking about how to do thematic analysis, right? It gives you a set of steps. They're not rigid, they're very flexible, because thematic analysis can be very, very different, but it gives you a set of steps, guidelines, strategies to accurately and comprehensively extract themes, ideas, and concepts from text for findings. So all of you have done thematic analysis, but thematic analysis is what we associate with qualitative research. But there's also content analysis, right? There's also framework analysis. There's lots of different types of analyses that can be included under qualitative research. And that's out of scope for this research. We have an entire qualitative research program that we're releasing later this year it's a 15-week program that helps anyone to go into qualitative research, because it's a very complicated set of methods that most people aren't familiar with, right? So you can see that it's not as easy. If you have an entire program, there's lots of different stuff to know about it. But this presentation is intended for you to know the difference. So whenever you see the difference, you'll be like, Omer told me this, I understand it fully. And maybe we'll explore workshops on qualitative research in the future. And the last thing I want to talk about is knowledge mobilization. Right? This was the last component. So I want you to think of knowledge mobilization as one of the most key aspects of your research career. And trust me, and this is very hard for people to understand, but trust me, coming from me at this stage, it's not just about manuscripts. It's not just about published manuscripts. I want you to know, if you really want to go far in your research career, often you have to do things that are not published as manuscripts. But that is part of the research game. I'm telling you, it's part of the research game. You may not value non-published manuscripts as much because they're not a criteria in whatever residency or other type of job that you want. They're not an explicit criteria. But I'm telling you, there's explicit criteria and there's implicit criteria. You doing other types of knowledge products that are not published in journals helps to build your research portfolio, and that research portfolio builds your reputation, and that enables you to get what you need and enables you to go far. If you work on building your research portfolio, which includes manuscripts, no doubt, I'm not going to say it's useless. Manuscripts are probably the most important part, but they're not the only important part, right? If you focus on building a research portfolio, you will go far and you will be differentiated from people who just get a one-off publication, right? So think long-term at the same time as short-term. The publication might get you that job right now, but where do you want to go, right? Do you want to just get that job? But once you get that job, you might want to go somewhere else. You might want to increase, like you want to be known as someone who some people can go to answer the questions on this topic or this specialty, and that requires you to build a research portfolio. Now, recognizing not all people are interested in that, right? Some people are just interested in manuscript, which is fine. But I iterate this and try to reinforce it for you to understand if you really want to go the extra step, which lots of people do, it's not just about manuscripts. Manuscripts are an important part, but they're and if not, they're the most important part, but they're not the only important parts. To go to the next level, you need to be creative and share your research large and wide. Remember when we talked about the components, I said there's traditional knowledge mobilization and there's non-traditional knowledge mobilization. Traditional knowledge mobilization, who's going to read it, if anyone? Right? General people don't read it, right? There's so many articles, there's billions of articles now. Generally, people are not going to read articles. But if there's someone is going to read an article, it's an academic or a student who's interested academically in your work. But that's just a small population. That's just a small group of people. And they're not going to really do anything. They might cite it in their paper, sure, fine. They're not going to really do anything, right? Or, you know, in some cases, they might give you a job, right? Like as a fellow, fine, that can happen as well. But they're one aspect of it. And the other aspect that people miss is sharing it to other audiences, people in power to make decisions, the public, community members, community organizations, other research institutes, right? These are different organizations that also have the power to help you get to where you're at. And sharing your research to these groups doesn't happen through manuscripts, at least it's not the best way. It happens through abstracts, doing presentations, like for example, presentation at a community center, right? Writing blog posts, creating videos, contributing to podcasts, and so much more. That is knowledge mobilization, and all of those pieces where those opportunities arise, build your research portfolio. Doing interviews, right? Sometimes my work has been caught by news agencies and I had to do an interview. That is part of knowledge mobilization because it gets my name and my work across. And even think about this. Manuscripts are a good way to share your knowledge with academics. But I would argue manuscripts are also not the best way to share your research with academics either. Academics are humans. They look at news articles, they look at blog posts, they go on social media. Likely, if you approach the non-traditional knowledge mobilization methods, you're more likely to get to more academics. And then they may be like, okay, let me take a look at the full article and find it and read it. But to grab that attention, non-traditional knowledge mobilization methods are more effective, even for academics, but especially for decision makers, community members, and things like that. And you don't know what kind of opportunities can happen from engaging all this work, even if it's not published, or I should say, even if you don't have a line of it in your CV. Now, the last thing I'll say about knowledge mobilization is generally all studies that are done should have a knowledge mobilization plan. And this knowledge mobilization plan becomes part of sort of the research journey, the research proposal. The knowledge mobilization plan, when you're conceptualizing the research and developing the proposal, includes, okay, what manuscripts are we writing? Where are we intending to publish it? What conferences are we going to submit abstracts to this to? Do we have academic conferences? Excuse me, do we have academic conferences? Do we have applied conferences? Do we have conferences for readers and things like that? Because sometimes that happens as well, especially here. How else are we getting this information to the broader population, right? Are we going to have a short video describing our study and put it on social media? Are we going to write blog posts of these small, like very niche blogs that talk about healthcare issues, right? So I've written lots on leadership and administration blogs just to share my experiences, my opinions, my perspectives. It's gotten lots of likes, lots of opportunities from those, like lots of conversations. I've networked considerably. Videos, I've been recently for about a year and a half getting into more content development, talking about different ideas and concept, and that is a very easy way to get your name across the world. And podcasts, right? These are all things that are part of the research proposal, and usually a knowledge mobilization plan is required whenever a research proposal is developed. Now, it's not to say to do all these things, right? I think it really depends upon the research project. One study I'm doing now is a narrative study of military personnel with chronic pain to identify their experiences in the military and after the military. Part of that is, of course, we're going to publish, right? Because it's going to be a qualitative study. We're going to publish. We're going to present at conferences. That's the traditional knowledge mobilization. That's always there, right? But we're also going to have videos of patients talking about their stories, right? Talking about their experiences in the military, talking about the experiences afterwards. And we're going to publish those on YouTube, on our channel, etc. And then we're going to have podcasts as well with some experts reacting to these stories. Right? You could think like these are non-traditional knowledge mobilization methods that are already included within a lot of studies. And we were funded for this work. So the funding organization agreed and they're supportive of doing this kind of work. Okay, that was the last component. I hope that made sense and I hope that was helpful. Quick break here if you want to get up for a couple minutes, sure. If you have any questions before we get into the activity, feel free to say those questions in the chat box now about anything, knowledge mobilization, data analysis, anything that we've discussed. And if there are no questions, then we'll get into the activity, which is not really activity. It's more of like just doing it along with me. So quick 3 minutes, get up, hydrate yourself, anything. Okay, so we're gonna talk about those three articles that I sent, so take a moment to pull them up. We'll start with Menon 2021, which is the quantitative article. And give me a moment, I'll start to show my screen. Let's see. Article now. So originally, how these workshops were designed, it was designed for sort of group activities and independent work, and then coming back and sharing your thoughts. Received some feedback from last week from a couple of you to be a bit more directive. So I thought to change this activity a little bit more to sort of have you do it with me, right? So we'll do the activity, I will do the activity, and then you follow along, do it with me, and if you have questions, put them in the chat or let me know. So the purpose of this activity is to try to bring together everything we've talked about. If you recall, we talked about research approaches, quant, qual, mixed methods. We talked about sampling, recruitment, data collection, data analysis, knowledge mobilization. That's a lot of things. That's a lot of like me talking. But all of this is reinforced when you look at articles and look at how they have mentioned all these different components. So that's what we're going to do. We're going to just focus on the abstract. I might go into the findings and methods just to reiterate some stuff, but primarily the abstract of these articles. And I showed these articles in the slides as well. So I'll read all of them together, okay? I'm just going to increase the size a little bit more. All right. So just to recap, this is the quantitative article. This is looking at ovarian. So, I mean, from the title, we can tell it's about people with ovarian cancer who probably undergo screening and they're interested in mortality rates. Another aspect is long-term outcome. It was done in the UK. It was a part of a randomized controlled trial of ovarian cancer screening, and they're an acronym. So this is probably like an organization type of lots of different institutions working together. And of course, in the title says randomized controlled trial, which is a good practice to have. Mentioning the study design or the methodology is a good practice to have in the title. But let's quickly go through the abstract, starting with the background to understand a little bit deeper of what they are saying. And we start with the quantitative because you've probably done this yourself, but doing this process and then going into the qualitative will really reinforce how differently the findings and the studies are and how you approach them. So quantitative. So in the beginning of the background, of course, they provide context, right? Why are we looking at ovarian cancer? Ovarian cancer continues to have poor prognosis with the majority of women diagnosed with advanced disease. Therefore, and this becomes the objective for the particular study. So we talked about the broad aspect of why ovarian cancer. Now they're focusing on their study. Therefore, we undertook the UK collaborative trial of ovarian cancer screening to determine if population screening can reduce deaths due to disease. So whenever I look at abstract, this is the objective, right? They undertook a trial to determine if screening reduces death due to disease. And then they say we report on ovarian cancer mortality after long-term follow-up in the trial. Then get into the methods. So clearly, very, very good practice. The first thing it says that it is a randomized controlled trial. Then it goes into population. Post-menopausal women aged 50 to 74 years. Then it goes into recruitment, recruited from 13 centers in the NHS, the National Health Service, trusts in the setting, England, Wales, and Northern Ireland. Lots of information in just this one sentence. The study design, the population, the setting, the recruitment, and then goes further. Exclusion criteria were bilateral oophorectomy, previous ovarian or active non-ovarian malignancy, or increased familial ovarian risk, right? Exclusion criteria of, exclusion criteria, I don't need to go into that. Then it goes to more specifics about the randomized controlled trial guidelines, right? So there was a management system they used for the trial to confirm eligibility. They randomly allocated, so that's the randomization procedure, in blocks of 32 using computer-generated numbers to annual multimodal screening, right? Now, I don't fully understand the specifics of this, but this is how they randomized it. What I assume is it does, and I'm sure we'll talk about more in the method, so you can always take a look. I assume it's something along, they divided participants into blocks of 32. Those 32s were, those block of 32 patients were randomly assigned using a random sequence generator, and they were given a particular label. They were identified as cohort 1, cohort 2, cohort 3, and they were given specific, they were like analyzed individually and separately based on their outcomes. Annual transvaginal ultrasound screening, USS or no screen. So these are the different, so these are the different groups, right? So the ones who receive annual multimodal screening, the ones who receive annual transvaginal ultrasound screening, or the ones who receive no screening. So you have 3 groups here. Right? This gets into more of the randomized control trial methods. There was follow-up. The 1:1 to 2 ratio is another randomization lingo. If I start talking about it, we're just going to have another, how we're just talking about randomized control trials. So for more of this, read up on it. And then it goes into outcomes, right? It goes into, so the primary outcome was death due to ovarian or tubal cancer with the WHO 2014 criteria by June 30th. So the outcome, the primary outcome, how they define the primary outcome, the WHO 2014 criteria, and what is the date that they're defining the outcome with, right? Right, and the date is important because if they died before the date, that they will be recorded as a different outcome. If they didn't die, then they were survived. Then analysis was also done. Analyses by intention to screen, comparing the two groups, separately with the control group using the versatile test. And then it talks about blinding. So this is about blinding, masking and blinding. So investigators and participants were aware of what screening type they were getting. But the outcomes review committee were masked, were blinded to which group they were looking at. So we're looking at MMS, USS, or no screening. All methods, all recruitment, data analysis, data collection, all kinds of methods. Quickly into the findings. Well, I won't go into detail on the findings, but you can tell lots of numbers, lots of percentages, lots in the interquartile range, right? The 95% CI, right? This is a quantitative, full-on quantitative study. It defines to you the timeline. From April 17, 2001 to September 29, 2005. It talks to you about how many women they invited. About 1.2 million. It tells you about, of those 1.2 million, how many were actually recruited and randomly assigned. About 200K. And then of those, how many were actually included in the analysis? About 200K, but less than how many were invited. And then it defines how many per different groups, right? The 3 groups that we have. And then it talks about the median follow-up. It talks about all these demographic characteristics, and then it goes into the findings. Compared with no screening, there was a 47.2% the CI increase in stage 1 and 24.5% increase, a decrease in stage 5 disease incidence in this group. Overall, the incidence of stage 2 and 12 disease was 39.2%, higher in the MMS group than in no screening group, whereas the incidence of stage 3 or 4 disease was 10.2% lower. 1,200 women died of the disease, and then defines how many per each group. But there was no significant reduction in ovarian and tubal cancer deaths observed in the MMS group, meaning p-value, which is above 0.05, so there's no significant difference, or USS compared with no screening. I mean, all of this is statistics language. I think the last sentence is one of the most important sentences for differences. But then usually these abstracts, especially quantitative ones, this is where I find helpful. It goes into the conclusion or the interpretation that doesn't use all these numbers and statistics, but really gives you what's the main point of this. The reduction in stage 3 and stage 4 disease incidence in the MMS group was not sufficient to translate into lives saved, illustrating the importance of specifying cancer mortality rate as the primary outcome in screening trials. Given that screening did not significantly reduce ovarian and tubal cancer deaths, general population screening cannot be recommended. That last point is the implication. Because screening didn't reduce deaths, we cannot recommend population screening. What's the point in doing population screening? Yeah, if you can't recommend it. So you're very familiar with it. And maybe I was thinking maybe I should have gotten some studies that are very similar in topic, but nonetheless, it makes sense. Okay, next one is the qualitative. And I think mixed methods we may touch on, but you have them and feel free to read them as an example. So immediately off the bat, you know it's a qualitative study, not just because it says qualitative study in the title. There's not a lot of numbers, right? See the abstract, where are the numbers, right? Just the age maybe. It's a qualitative study. Very different. You're not going to be looking at p-values and see, unless the mixed method studies, then you'll have some of that. But as a qualitative study, you won't see that. So this, just to recap, is about what matters most to young people who are treated for chronic pain. So again, every abstract generally starts with the big picture. Global and national policies state that all children and young people should be part of decision-making and that outcomes that matter to them should take priority, right? Yeah, you all agree, right? We should understand what patients find important and we should prioritize that because the treatment is for the patient at the end of the day. Yet, patient-centered outcomes have been identified as a gap in the pediatric chronic pain literature. So they've identified the gap. And then, of course, once they identify the gap, they follow up with what they're doing in that study. This study gave youths experiencing chronic pain, so the population, a platform to have their views heard. So listen to their views, to understand their views, to understand their experiences. Using novel methods, which they don't describe much here, but describe to some degree, 21 young people, so the population, how would they define young people? 11 to 18 years old. What did they do? They completed a semi-structured interview. Right? We talked about interview guides, in which they constructed a timeline drawn to symbolize their treatment. What does that mean, right? It's not very clear here, and the methods are a little more clear, and maybe I'll go into the methods very quickly. But from what I understand is they have the researcher, they have the youth, and the question was, on this piece of paper, can you draw on all the stages of your treatment from the start to finish? And then they were allowed to do whatever they want, right? However they want to convey it. And then by the end of it, you had like a piece of paper, and you had like different stages, diagnosis, treatment, recovery, etc., whatever, in different ways, because different patients, different young people will describe it in different ways. And then the researcher, I assume, had a conversation about it, asked follow-up questions about it, right? So tell me more about this stage. Tell me more about this stage. Okay, you said that you had trouble at recovery stage, or you said you had lots of side effects after the surgery. Tell me more, right? That's what I assume this is getting at. Then the other thing I want to talk about here is the findings. Now, as you can see, findings are also pretty much take up half of the abstract. So they identified when aspects of their life changed, and described the importance of these changes. Now I want to stop here. This is what This is why qualitative research and this qualitative study is so interesting. Because a randomized controlled trial would not tell you this from the perspective of young people with chronic pain. Talking to them, you'll be able to understand why their life changed and the importance of those changes to young people. How do they analyze it? Thematic analysis, right? Identified 4 themes. And this is how usually qualitative studies, right? Because you have to really summarize it in a few words. So they'll identify the themes as based on their title, right? So 4 themes that emerge at different stages of the treatment. Perfect storm, theme 1, turning points, theme 2, disconnect, and free. So just by this, you know that the article, when you go into the findings, it's based on these 4 sections. It's going to talk about turning points, disconnect, perfect storm, free. What it does better here, it actually describes at least the first, at least one of the themes. And again, abstracts are very short, so you can't really describe all of them. But turning points were points in time when the narrative, the story, the experience of their journey of a young person took a different direction. At these points, the outcomes important to them also changed, right? So it's a turning point when the journey, it changes, the outcomes that are important to young people also changes. And that's such an interesting finding to know when you actually meet someone with chronic pain. You understand it better, you understand the nuances better, and that can help you to provide better and more tailored treatment that in the end will be more meaningful to them and also more effective. Youth initially prioritize outcomes related to pain, right? Then during treatment, the focus became emotional functioning, with role functioning and going out becoming the focus at the end. But this is just give you an example of how the outcomes change. The stage of the treatment as perceived by young people impacted which outcomes matter the most. You can start to see how this is very different, not just in what the study wanted to do, but also very different in what the study actually accomplished and what conclusions and what kind of understanding you're getting out of the study, right? Now, this is not the best study. Purposefully, I included that because it doesn't include some essential aspects that you would need from an abstract. So often for qualitative studies, you have to go into it. Doesn't really give you much detail about recruitment, and the methods are very sparse, right? There'll be enough in the abstract for you to know, but the abstract is could be improved. And that's a struggle that all qualitative studies have to go through because the findings are so light. But compared to the randomized control abstract, the findings were maybe a quarter to 1/3 of the abstract. This is it's more than a half, right? So that's a struggle. You won't find much, but you find enough information, and mostly the findings are the most interesting as well. So I hope that makes sense. The methods are long, and this will give you everything you need, right? You can see data collection, data analysis, lots of different, what the data software they use, more details on thematic analysis, more what data collection method they use, lots of details here. But I hope that makes sense. I'm just seeing if there's anything else I want to say here. You definitely read the methods to get a bit more understanding and reinforce some of your points and remember some of the points that we talked about. But you can see theme 1, perfect storm, right? What was mentioned in the abstract. And this is a visual of all the stuff that they develop. Sometimes qualitative research have these as well. Section 2, theme 2, turning points, right? And another thing I guess another important thing with qualitative research is, so there'll be sections and there'll be statements, right, to describe the theme. And then there'll be quotes, and these are quotes from participants. And the purpose of these quotes is to add nuance and rigor to the study, right? Anybody can say patient said this, this, and this, right? But because qualitative research has to be rigorous, has to be evidence-based, often they say the argument, and then they provide evidence to that argument using a quote from a participant to just further reinforce the point. Now, as you can tell, this is very subjective, right? And that is where I will end this conversation. It is qualitative research. Let's do this. Qualitative research is subjective. It is, but I don't want you to think of that as a disadvantage of qualitative research. Qualitative research doesn't care about subjectivity. That's actually where qualitative research comes from. It actually prizes subjectivity, because the goal is not to generalize to the broader population. We're not, from this study, we're not going to say all people, all youth with chronic pain think this is the case. That's not the goal, right? That's the goal of randomized controlled trials. Yeah, no doubt. Therefore, the methods have to be according to accomplish that generalizability objective. The qualitative research is trying to help you understand the why and the how by looking deeply at a group, a small group of people, without the objective of generalizing comprehensively, but with the objective of helping you to better, at least a little bit better, understand what are the issues, why are the issues, and what we can do about them. And that's what quantitative research doesn't do as well. And that's why we need both. Sometimes at the same time, sometimes sequentially. And that's what I'm going to end off here. What's the time? 3 minutes. So if there are any questions, I know we've stopped lots throughout this presentation, but if there's any questions, I'm here for a few more minutes. And we'll end off here. You're free to leave. If you have any questions afterwards, feel free to message me on WhatsApp. Feel free to email me. And for your certificate, please email info@methodologists. Chat info@methodologists.org with your full name and your email address, the same email address you used to sign up for the workshops. And we'll get them in 1 week. But thank you for attending this second workshop. I look forward to seeing you again in about a month, a little bit more than a month, for our third and fourth workshops. Take care. Good luck.